Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome back, everybody. Our guest today is Ciara Donlon. Ciara, please tell us where you are in the world and what you do for a living.
Hi, Matt. Really happy to be here. My name is Ciara Donlon, as you said. I'm in Dublin, Ireland today. The sun is shining, thankfully. And my company is called Theya Healthcare. So I set it up back in 2015, probably one of Ireland's first femtech companies, to design breast cancer bras for women after surgery.
That's amazing. So I see it's clearly developed into, playing more SKUs than just that product. That's interesting to know. That's was kind of the inception. So in the beginning of the brand, what's kind of the backstory to that got you into creating that product as like an initial kind of stepping off point for the rest of the things that you have with the brand now?
Yeah, sure. Absolutely. So actually my background is business and marketing. So I did over a decade in corporates, working online when it wasn't that sexy, from like 1999 to 2010, when you had to beg for money for the online channel. That's not not the same now. So my last corporate role was in Vodafone. I was head of the online channel, and I left there in that big recession with a pot of money. No idea what I wanted to do. All I knew was I wanted to do it for myself. I'm from a village in Dublin called Ranelagh, and it's a funny story. I was in buying a pair of shoes in the local shoe shop, and the lady who ran the shoe shop was a lawyer by trade. And I was like, how did you end up like owning a shoe shop? So we started talking about changing businesses, etc. Told her I wanted to open my own business, and she suggested a lingerie shop, that there were a lot of pregnant women in that neighborhood. And she said, you know how hard it is to get good underwear. And I had women, I had no children then, but I had women on my team who had issues in Vodafone getting decent underwear when pregnant. So I went out, did my market research with 80 women on the streets, went to one of our national banks called AIB, looking for a 50% loan to open the store, which was called Cupcakes Lingerie. And they gave it to me. But the interesting thing was that they were actually completely broke. It was just before the news broke that the banks were all broke. It was just before that came out. And they half funded me. I opened up next door to them in the village and learned the industry. I knew nothing about lingerie at that point. And learned how to fit, which is probably a new concept to you. But fitting bras is an art in itself, and most women wear the wrong size bras. So I learned how to do that. The business became very successful, and it was while I was running it that I noticed that I had breast cancer patients coming into me who were going to buy my nursing bras. And I didn't understand why, because there are mastectomy bras out there. There always have been, particularly for after breast cancer surgery. So in talking to them, I discovered that what were given to wear were pretty much instruments of torture. They were like large, bulky, uncomfortable, made from synthetic materials. None of them were using natural materials. They had tags, wires digging into them. Like, you probably may or may not know this, but after breast cancer surgery, you have to wear the bra for 8 weeks. And the only time you take it off is when you have a shower. So it is pretty much your best friend for those 8 weeks. And they were awful things that were out there. So that was the catalyst for me to go and get funding with Enterprise Ireland, which is kind of like Ireland's state venture capitalist company. So it's state run, but they invest in early stage businesses. So I got a feasibility loan to do research with them to see whether or not my idea was correct about there being a gap. There very much was, and it was very much when a woman is getting diagnosed with breast cancer, her self-confidence is very low. She's thinking about her family, her children, not about herself. So I designed a range of bras with breast cancer patients, because we interviewed 100 of them as part of the process. Made them all from bamboo, because all the women were talking about itchy, scratchy, uncomfortable synthetics. There wasn't even a cotton bra back then in 2013 on the market for this. And as you probably know, if you wear polyester, you sweat a huge amount. So if you could imagine that you have to wear that to bed all the time, how uncomfortable, and even the odor, how awful it would be to wear that all the time. So I wanted something better than cotton. That's what I went looking for. And I discovered bamboo, and bamboo is becoming a lot more popular in Europe. I don't know how popular it is in the US, but
I would say more with like I've seen a lot of bamboo like sheets and other kind of like upholstery, I would say, more than that in apparel. But I mean, it's definitely something that people I think are more aware of. But I'm interested to know the benefits of bamboo, because I don't think in the apparel side is not something that's gotten very big, I don't think, in the US yet. So I'm curious, what those kinds of benefits are. Yeah.
Yeah, so it's interesting. I suppose you're from the land of cotton, which is probably one of the reasons why bamboo is still not as prevalent over there. But bamboo is pretty amazing. So it's naturally antibacterial. And we actually did a clinical study here in Ireland, and we grew the two most common bacteria found in breast wounds on our bamboo material. And we also grew it in cotton. And the bamboo resisted the growth by 93 and 97%, which is incredible.
Wow, yeah.
And unfortunately, there was zero effect for the cotton. We also proved that it was twice as breathable as cotton, 60% more absorbent, and 20% more wickable. So if you are in a situation where you're having radiotherapy treatment, or if you're on chemo, if you're taking any type of drugs that are making you perspire and sweat, or burning your skin, so bamboo will cool you, it'll soothe your skin. It's hyperallergenic as well, so if you have any type of skin conditions, it will actually heal them. It's UV resistant. It's very, very soft to wear as well. And it's sustainable. So that was the really big thing for me that I didn't know about bamboo. But bamboo sucks 5 times more CO2 out of the atmosphere than trees do. It doesn't use any pesticides, fertilizers to grow, no water either. And cotton is responsible for nearly 30% of pesticide sales worldwide, which is massive. It doesn't use insecticides either. And if you compare it, say, to cotton as well, for one t-shirt, cotton would use 20,000 liters of water. And there's no extra water needed for the production of bamboo. And actually, bamboo is hard to stop growing. It's the opposite problem. It grows like wildfire. It grows fast. But the great thing about it is, as well, it actually prevents soil erosion, and it regenerates soil. So it not only ticks a lot of environmental boxes, but it also ticks a lot of healing boxes. So all of our products use bamboo, use a very good high quality grade of bamboo. So the healing properties are still present at the end of the process of becoming your bra or your briefs or whatever. And when I realized how amazing bamboo was, I had started this for breast cancer patients, but it has now grown, and we now have products for women in nearly every life stage. So like we would cover post-baby, we would cover skin conditions, cosmetic surgery, breast cancer. And we have recently just launched in the period pants space. So the whole menstrual market space, which is, I suppose it's new that we're all talking about it openly now, but it's about time that it has happened. So we have just launched a pair of medical grade, or 2 pairs of medical grade period pants made from bamboo and graphene. So graphene is carbon, coal, basically. So we're using that in the absorbent core. So basically where the pad would be. And the reason we're using the bamboo and the graphene is that both are antibacterial, highly antibacterial, and both are odor neutralizing. So it means that there's no smell, which is also a great plus to bamboo, especially for breast cancer patients, for example, if they're wearing a bra. A lot of cancer patients don't want to use any type of chemicals on their skin anymore. So they don't have to wear deodorant, for example, if they're wearing bamboo, because they won't sweat. It'll keep you from sweating. So we did get patents because of all of the science that we did on the actual bamboo. Nobody had done any studies in the West on the benefits of bamboo in garments, which we did, which was great. So as a result, we supply national health boards in the UK, in Ireland, and in other European countries as well. But I'm really excited about the launch of the period pants, because it's this reusable market that we all need to start going towards if we've any chance of saving this wonderful planet of ours.
Yeah, that's amazing. And I mean, it's certainly something that is definitely something I've heard that more in talks recently, even in the States, is with period pants. And what would you say was kind of like the catalyst for you in moving into that side of things? I mean, what has kind of been the general sentiment of women? Like, what's the big problem that they're facing that they're looking to have these more reusable options? I mean, obviously from a, sustainability and, ecological perspective, it makes perfect sense. But from a functional standpoint, I know there's, a lot to be said for, what period pants can do that, they're just like benefits there that you wouldn't get from a traditional, like, pad or tampon or things like that. So can you tell me a little bit more about that?
Yeah.
And like feedback you've received? Yeah.
Yeah, so it's actually very interesting. The tampon was first introduced 90 years ago, and it hasn't actually really changed since. But unfortunately, most tampons, they contain an awful lot of harmful chemicals. So there's forever chemicals in them, which I'm sure you've heard about, but like they literally absorb into either our bodies or into the soil, and they literally never leave the planet, and they're very bad for you. There's bleach has been found in pads and in tampons, glue, chlorine, like horrible stuff. And this has been this is internally put inside you for a couple of days, a month. And up until recently, they weren't even regulated. So, you would go down to the shop and you would buy your pasta and you would have all the ingredients on the back. Or if you went into a shop and got your joggers, they'd have whatever is included, whatever has been used in material. Well, women were being told to use tampons and pads. And if you look at a box still today in most places, it will not tell you what is in them, which is very worrying. And there's have you heard of toxic shock syndrome? So toxic shock syndrome is a bacterial infection that you can get from tampons. And now everybody has always been aware of this, right? But there have been a lot of myths put out there that it's the length of time that you have the tampon in, that it's only if you don't change it after X amount of hours, etc. So that is all not true. And the truth is that you could get toxic shock syndrome at any point. So every time you use a tampon, potentially you are putting your health at risk. And not only that, but the chemicals that are in both the tampons and the pads mean that it upsets the pH balance of your vagina and your vulva, which basically means that you can become unhealthy or get infections easier. So the great thing about the reusables is that firstly, you're not inserting anything inside you, which is better. But the other thing is as well that ours, for example, are a medical device, which means that they have to be made in a factory that is regulated to a very high standard, including with the FDA. So it means that we know that there are no harmful chemicals, dyes, or anything else have been used in the production. Whereas if you go down to your local sports shop and buy a pair of period pants, and for example, Thinx last year, who were a market leader in the US, they had a massive lawsuit against them, which was successfully settled against them because a number of their customers had gotten very bad bacterial infections as a result of the chemicals that were found in the absorbent core. So what I think is awful in one way is that all of these companies have jumped on the bandwagon of menstrual pants, but they are not being made equal. And some of them are just as bad and dangerous for your health as the tampons and the pads are that we are trying to get rid of. Now, if you compare it to the disposables for the environment, yes, very much better, because obviously if you are like tampons take 500 to 600 years for one of them to decompose. And a woman would use on average of 70 kilos in their lifetime. I'm not sure what that is in imperial, but it's a lot of tampons that are going into landfill or going down the toilet, which means the water companies then spend millions taking them out of the water system as well. So it's either in landfill or in the water system. Whereas if you are buying period pants, 4 pairs of them or 4 pairs of ours would last you 4 years. And that's it. That's all you need. So there is none of this massive waste from all of the disposable packaging as well as the actual products themselves. It's better for your health. And it's also saving you a lot of money in the long run to go down that road as well. So it's kind of tick, tick, tick box for all of them. But I suppose like anything else, where we're coming in to disrupt a market that has been there and that is extremely profitable. So trying to do that takes time, and it's about education and getting younger girls. So like when they're starting their periods, that they don't ever start using the tampons or the pads. And even the freedom that gives you for playing sport as well. Like a lot of girls in Ireland, 50% of girls drop out of sport by the age of 13. And a lot of it has to do with starting their periods, because they don't want to leak, they don't want blood, they're embarrassed. And if you may have noticed, an awful lot of sports gear is still white. So it makes it quite difficult if you're a female, you don't know when your period's coming, if it's just started. So the period pants help with all of that, all the embarrassment as well, and they give girls an awful lot more freedom. So I'm delighted to be launching them. And actually, the other thing is that we've made them very reasonable. So they're $20 to buy, whereas a lot of these equivalent ones that I mentioned can be a lot more expensive, which is a barrier in its own right for a teenager to buy them. So I want to make them affordable and accessible for everybody, so that hopefully we will have the next generation of girls won't be using disposables at all, and they'll be using reusables, which is better for the planet and better for their health.
Yeah, no, it's so amazing. And I had a chat with somebody recently, actually, that it wasn't in this exact space, but it was a medical grade kind of piece of apparel that wasn't necessarily something you would be prescribed per se. But I'm just curious if it's crossed your mind where, because this other brand I spoke to, they basically were able to get it set up where people could go to their primary care doctor and ask for this product, and you actually use their insurance to be able to get it as like a preventative care, actually. So is that something you've considered with this? I know you're making it medical grade, taking all these steps to ensure that it's, checking all these boxes.
Yeah.
Like, is that something you've considered, or have you found that that's probably not something that would be possible?
Yeah, well, unfortunately, because actually it's an interesting question, because in the US they have made the period pants medical devices, but they're not treating a disease or sickness, because periods are just normal. They just happen in a woman's life. But in terms of our breast cancer bras, yes, it is something that we could look at doing, is getting them on Medicare or Medicaid. I suppose that the block to that is that it can take a huge amount of time to do so. And that in itself, it can cause an awful lot of money as well to go through that process. And we don't need to, even though it is a medical device, we can still sell it as lingerie. But it just means, unfortunately, that women who need the care, the extra insurance, or rather the state-funded insurance, can't avail of it. But if you have private health insurance, you could request that the money, you use the money to buy a Theya Healthcare breast cancer bra. Here in Ireland, the women get 2 bras free every year, once you're diagnosed with breast cancer, and you also get free prosthetics every 2 years. So each country is different in what they provide. So women here would be able to they wake up in hospital with the bras on after the surgery, and then they would get another one before they leave hospital. And that would also be the same in the NHS, which is a UK system, which we also supply to. But I mean, universally, we should be looking at a situation where all women who have breast cancer can get these bras, and that they're covered by the state. But unfortunately, that isn't the case, and they can be quite expensive, which is another reason why ours are quite reasonable. So they're $45, the breast cancer bras. Again, some of them can be over $100. And if you're going through cancer, I'm sure from talking to people, it can be a very expensive time. And then to add on to that, the cost of buying these bras, and you need good support after your operation. But sometimes you just can't afford to buy them. So you end up then buying a bad bra, and actually that can result in complications or reinfection or readmission into hospital. Like in the US, after breast cancer, depression and readmission for bacterial infections are the 2 main payouts from both the hospital system and from health insurers. And actually our bras can help with both, alleviate both, because they actually help women's self-confidence a lot because of the way we design them. It was with the ladies themselves, and because of the antibacterial nature of the bamboo, you have a much lower chance of getting an infection wearing our products. So it's all rounder a good investment for $45 as well. So the next thing I want to tackle is menopause. So that's next, because the bamboo can help with the sweating and cooling, etc. It's really good for women who are starting to go through menopause. Also, it could help for men, but we haven't gotten around to the male ranges yet. But it is planned that we will, because the period pants also are great for incontinence, ladies who suffer from drip incontinence. And I actually do have some customers males who use them, the pants as well. But they're not designed at the moment for men. They're still women. But the plans are, as we get bigger, that we will be able to create ranges for men. But you should go look for a bamboo pair of boxer shorts now after this call. They are very comfortable.
It's funny you said that because I've actually been using bamboo sheets for the past probably 5 years of my life, because once I tried it, I never went back to it. But I don't know. I guess I've just never seen any kind of like marketing or anything about it being in apparel. I mean, it's not even something I thought really existed. I mean, not that I was looking for it, but it's definitely not something I've come across, because if I did, knowing how much I love my sheets, I probably would have tried them by now. I don't know if
Yeah.
I mean, as you say, it's probably a, in the US, I mean, it is, it's the land of cotton. That's what we do. That's why all the people that try to come in and grow hemp or bamboo or all these things, they get pretty much shut down pretty quick, because that's a big industry. It's hard to tackle. But I definitely know that it exists, and no, I think I definitely do need to. And let me ask you though, I'm just curious, because there's an area with apparel brands that I speak to. One area of like a lot of variability that I find is in the process of the basically like the product development phase, not even pre-launch, but even as you're continuing to grow and you have this these product developments into new areas like the period pants, and you're looking to get into more like a menopause line, right? What does that process kind of look like for you? I guess in two specific scenarios, like what was the original product development timeline look like for you for the original bras that you made, and then how do you kind of go about tackling product development on a more like kind of efficient scale as you're moving forward and have more funding, and maybe have some of the other things in place rather than how it was like in the beginning, if that makes sense?
Yeah. So yeah, it's a really good question. So for me, everything is about the lady that is going to wear them. So the beginning of every single product development process for me starts with talking to our customer. So for the very first bras, we did focus groups both in Ireland and the UK with breast cancer patients. Some of them had been 10 days post-surgery, some of them had been 10 years post-surgery, but it was to understand for them the journey that they went through and how they felt about what they had to wear and how they felt going forward, because a lot of women couldn't ever go back to wire bras after having breast cancer. And a lot of it is psychological. So an awful lot of it was about not feeling feminine anymore and not feeling like a woman. And they didn't want sexy, they didn't want lace. So it was really interesting to listen to them. They wanted prettiness, comfort, and to feel normal. That was the biggest thing. So the bras that we've designed, they have like little pads at the front. So even say they're waiting for reconstruction, it looks like they have breasts. So for them, even going to bed at night, they wear it, they put on their nightshirt and it looks like they have breasts. And that is what they wanted. And they obviously wanted to feel good in their own skin. Like our bras have been referred to as a hug in a bra, a comfort blanket, help me look in the mirror again, like really strong, amazing things. And it's just a bra at the end of the day. But the difference between our bra and other bras out there is that we listened 100%. So when we first developed the bras, we went to a factory in China because my designer had worked for like Marks and Spencer's, Triumph, for lots of big brands. And we went to some of the factories that she would have dealt with. We wanted to buy a very high grade of bamboo. So it had the good stuff in it by the time it became a material. So it still had the healing properties. And we literally found it very difficult. The Chinese didn't understand why we didn't want to buy the cheap bamboo. And I was like, no, we want the good quality stuff. They were like, why do you want to spend more money? But anyway,
Right.
We eventually spent more money, got the better bamboo, and as a result then we have all the amazing properties. But once the products were designed, Ireland, as you know, is quite a small country, so there's only like 6.5 million of us, so we used Ireland as our test case basically. So for a year we used the market to test the bras. A lot of the hospitals took us because I was an Irish brand. We got feedback from nurses, doctors, patients themselves. We fed it all back into the bras and we kept improving them. We still improve them, but like we have literally 100% B2B retention with our hospitals that we supply into, and like 98% with the women. Like really the only bad feedback we get is sizing, and that might be, I need a different size. Like they love them. Once they start wearing them, they really love them. And for me, that all boils down to listening to them. You have to listen and change. Like it was my idea, but I needed to make sure that it was right for the women that I was trying to support.
Right, yeah.
So you have to take into account their opinions and what they're feeling, which is what I think Nike, for example, at the weekend didn't do with their Olympic track outfit. Like it's just incredible.
Clearly not, right?
Clearly not. In 2024, It's like, what is that? Like so many athletes have come out and said, I can neither breathe, be comfortable, or race in something like that. Now they backtracked a little bit and said that there are other options available, but to come out with that in the first place just shows that they're totally out of touch with the women that they are trying to provide for, I assume. So for me, that's what being in touch and very close to those women. Like, I still answer emails from customers and I talk to them, because at the end of the day, if you don't get it right with them, you don't have a business, you know? So every other product that I bring out, we do wearer trials. So I might have the idea, but then we will develop something with the factory, but then it will go to wearer trial. Like, we're bringing out a nursing bra next month, and 30 second-time mums tested them. So I didn't want first-time mums to do it, because they don't know what they're doing when they're breastfeeding, and I know that from experience.
Right. Yeah, right.
So I wanted them to be on baby number 2 or baby number 3, so they knew what they were doing. And I got feedback from them, and then I was able to change it slightly based on that. So everything is about involving the woman, your customer, and keeping her at the center. And I think if you do that and if you listen, you can't go wrong, to be honest. Like, I mean, we know what we want, you know, which is, I think, you hear an awful lot from women at the moment. If you look at any of what's going on in healthcare and everything, women were thought to be small men for an awful long time, and our bodies were not actually taken into account for a huge amount of the healthcare system. And it's only now that our bodies are actually, they're listening at us. Like, women only accounted for 9% of clinical trials. Like,
That's quite fascinating, actually. That's the first time I've ever heard that statistic. That's very fascinating, actually.
9%. Even the lab rats were male. The mice.
Is that global, or is this in Ireland, or
no, this is global. This is global.
Wow, that's really fascinating. I can't believe that.
Actually, 2022, wait until you hear this. 2022 is the first year that a full female anatomy was used in a medical textbook.
Wow.
2022.
That's wild. I mean, I loathe to say that I'm not surprised, but I mean, to that extent is quite wild. Yeah.
It is quite wild. Like, I mean, our bodies have pretty much been ignored, to be honest, for a long time, and assumed that we were the same as men, but we're not at all. Like, our hormones are totally different. Our menstrual cycle makes us completely different animal, literally, to guys. And I mean, some of the medication on the market for heart attacks at the moment for men causes heart attacks in women, causes them. Now, there's wild stuff out there if you look into it. It could actually be quite depressing. But there's a book called The Invisible Woman. You should check that out if you're interested. Like, literally, the world was built for men by men. And it's only recently that another viewpoint has been looked at, and taking 52% of the population into account. There's a lot of us. It's only recently that we're now looking at it through a gender lens, which I think is why having female founders and female-led businesses is so important, because men can't design for women, really, because they don't sit in our skin, you know. Until you are in our skin, you don't really, just like I wouldn't try and design for you without involving men in the process. So it should be the same, that we need to complement one another. So we need businesses that are run by both. Like the VC world, you probably know, maybe you don't, that only 2.5% of money goes to women from VCs. I mean, which is just incredible. And I know so many amazing female-led companies and founders that find it much harder to get funding than the guys do. So it is so important for future generations that we have both sexes being innovative and inventing and coming up with products that they know will work for their own sex and that will help their own sex, you know. So it's really important to me. And when I grow up, as I say, I want to become an investor in women. when I've made enough bras and period pants that I can do that. But like, I suppose that's my mission, that I want to be able to help women to feel supported in each of their life stages, and feel comfortable, and that there's somebody listening and they're there to help them in what they need, you know?
Yeah, no, it's so important. I mean, in business and in life and in product development, I mean, just listening. I mean, you know, you think about you making a product for, you know, specifically for women, where traditionally maybe they haven't been listened to, or the choices were too limited, or they just didn't really make sense. So in making something like this, you you must have found that, a lot of women are probably very much willing and able to give their feedback on something like this that they know is made specifically for them, because it's just not out there so much. So I think that's really important. I mean, no matter what you're doing, if you're doing product development, running any type of business in any industry, and just as you navigate through your everyday life, I mean, you just have to listen to what the people's needs are around you. And I think you'll find a lot of peace and success just doing that, no matter where you are in any stage of life. So it's really important. And also, I actually had a really interesting conversation with an amazing woman a few weeks ago out of the US. She runs a site called the W Marketplace. And if you've ever heard of it before,
No.
she's basically like a women's own small bit, like online small brand Amazon is really what it is. I mean, there's probably close to 1,000 products on there from hundreds of women-owned businesses. And she also does her own accelerator program. So she's not actually directly investing in these businesses, but she is helping businesses get grants and teaching them what it's like to run a business, how to turn an idea into a business, and also putting them, turn around and putting them on her marketplace as well to help them get started with revenue too. So yeah, I find myself wanting to plug her so often whenever I'm having conversations with great women in business like you, because I mean, she just does such a tremendous job. And we can talk more about it kind of off the air, or I'll just send you a message on LinkedIn. But she's a really amazing person to work with, and even just to know about this. She runs the wmarketplace.com. I don't work with her in any official capacity. I just think she's so amazing. And I had a conversation with her a few years back, and it kind of streamlined like a ton of interviews with a bunch of other women-owned businesses. So I think she's just a great person to know. But in any case,
what she's doing.
Yeah. But in any case, I just want to ask you a couple last questions. So one, I guess, is just, I know you mentioned that you do have a B2B side of your business. Would you say that's probably the biggest like source of revenue for the business at this point? Or just kind of give me a breakdown, high level. It doesn't have specific numbers, but I'm just curious, like how much B2B you're doing, how much direct to consumer from the website you're doing. Are you on Amazon? Tell me a little bit more about that.
Yeah, so actually before COVID, we were 80% B2B into hospitals, and COVID changed everything. I'd obviously stopped breast operations as well for quite some considerable time. And we ended up, actually, to survive during COVID, my company ended up bringing in PPE into Ireland for our government, which was amazing that I had the opportunity, and it meant I didn't have to let any staff go, which was very important to me. But now it is kind of, we're back to 60% now B2B and 40% D2C. And online is, we only have one retailer per country really, and that is a strategy. So ladies can go in and try on. It's either online then or through the hospitals. That's how it works. All of my products have a rose, which make them, if you're in hospital, you'll remember it. And I've actually had women come up to me and go, "Oh my God, the products with the rose, it's you." And I wanted something visual that they would remember, because when you're in hospital, you're not necessarily going to remember what product you were given in the hospital. We actually do not work with Amazon. We work more with specialist lingerie or mastectomy online retailers. Definitely going to get in touch with your friend though. Currently looking to expand into the American marketplace. The plans were to do that during COVID, and they got derailed considerably, even though we do have US investors. And actually your hospital system is really only getting back to normal now after COVID. So if there are any of your listeners out there who would like to talk to me about bringing us into the US, I'd be very happy to talk to them as well. I want us to be as reachable as possible in as many avenues as possible. It's quite easy to buy these online now, though. The sizing is very easy, and you can talk to us. There's chat on the website, and they get to the US within 7 days. We have a lot of US customers that come direct to us on our website, which is theyahealthcare.com. But definitely, I see the future of the brand remaining very much in the B2B hospital space, and also online. I see those, and the online being the growth area going forward. Like, we've started now, we have an Instagram shop. We've just recently started on TikTok, which is a whole new world for me.
The Wild West TikTok. It really is.
It is. And putting me out there as the founder on it as well, which is a bit woo for me. But yeah, so it's changed dramatically since COVID, though. It's amazing, the change. And even prices have changed since COVID. I'm in a very lucky situation that I've been able to drop my prices recently, using an extremely good manufacturer. But I'm very lucky that I was able to. Our products are medical devices, as I said, so it kind of adds a little bit of complexity when you're buying them. They're not as straightforward as some other products for B2B, I mean, for the hospital systems. But yeah, I'm still on my mission to make sure that all women of all life stages can find some solace in bamboo products that make them feel good.
Yeah, that's amazing. And I guess if I could give you one piece of advice, just having interviews in this space, as far as getting into the United States is concerned, I don't know how it works in Ireland, but for whatever reason, there's two industries in the United States where basically everything goes through like a main distributor that basically acts as a marketplace for athletes
the GPOs.
and for hospitals. So I would say that if you it sounds like you already know that, but I'm finding that that's something that's very much specific to the United States, that it's not really like that in many other countries. So I know somebody had told me a story that it took them, as a US based company, a long time like to get in touch with people there to actually get like a good amount of volume going through those through those marketplaces that funnel to one was athletes, which like basically if you're a professional sports team, you buy everything that you want from this like one marketplace. It's a single distributor, and it's likewise for the hospital. So I think there's a little bit more variability and like choice in the healthcare side through those distributors and marketplaces. But it seems like for professional sports, there's basically like one. I mean, besides like the uniforms, obviously it's like one year it's Nike, then it's Adidas, whoever gets the bid on the deal. But all the little stuff that they need, like around the locker room and medical supplies that the trainers need and stuff like that, it basically all comes from the same distributors. A lot of brands that make the stuff, but it all funnels through like almost a single distributor. So I've heard. So that's definitely something to be prepared for if you want to get into the US market, selling B2B for sure. Just you're aware, I've heard that a few times. It's something I learned actually very recently through a few other brands. So
that's really interesting. Yeah, I'd even be interested to know who that distributor is into athletes. The menstrual products are amazing for female athletes as well.
Yeah, I got to find the name because I got to listen back to the recording. I think it was a podcast that I did that I don't think it's posted yet. So I'll go back and try to find the recording. I'll send you a message on LinkedIn of what that was because I think that might be helpful to you as you try to get into the US. But yeah,
Thanks,
just real quick too, before we go, I just want to give you an opportunity. I know you mentioned the website once. I just want to give you an opportunity to shout out your website again, all your socials. People listen to the podcast. They love you. They want to stay in touch. When's it coming to the US? They'll let everybody know how they can stay in touch with you guys.
Yeah, so it's Theya Healthcare, THEYA Healthcare.com. And we're on Instagram, we are on TikTok, as I mentioned, and both me and the company are on LinkedIn. So it's all Theya Healthcare is the handle. And I'd love feedback even from your audience as well. Like, as I said, open to all feedback. I'd love to talk to ladies who need a bit of support in the US as well, and open to product development. I get some of my best ideas from my customers,
Absolutely. Yeah. Well, yeah, I just want to say thank you again for your time. I really appreciate your story and what you're doing. I think a lot of folks would feel the same. And I hope, I just want to say I wish you the best of luck, continued success. Let me know personally, please, on LinkedIn when you start really getting firmly into the United States. Yeah, I'd love to spread the good word and hope we get some feedback from maybe some of the women in my family and friend circles.
Thanks a million, Matt. It's been a pleasure. I've really enjoyed it, and definitely keep in touch. Thanks
Likewise.
so much. See you. Take care.
Thanks, everybody.
Bye.